Honestly, I don't know what is going on with this patient. It's just these weird, vague complaints. I can't make any sense out of it. Well, I know one thing that it might be, and I'm going to tell you on this episode of One for the Road. Back in school, we learned that pulmonary embolism had this very specific and identifiable presentation, right? Air hunger, shortness of breath, pinpoint chest pain, pale, cool skin. Well, sometimes patients don't read the textbook, and they don't always present exactly like that. Pulmonary embolism is that clinical presentation that can really sneak up on us if we're not careful about it. So keep in mind that a PE can present in a lot of different ways that they may have never talked about in your textbook. And those include a toothache or any non-specific pain above the waist. And it can also be associated with leg pain. It can be associated with just vague, generalized body weakness, abnormal sleep cycles, orthostatic hypotension that you can't seem to explain, any kind of unexplained breathlessness, including a patient that presents a lot like a panic attack. In fact, the patient might write it off as a panic attack. And also any abnormal lung sounds, right, of any variety, including wheezes, rales, rhonchi, and maybe perfectly clear lung sounds. Maybe the one thing that is actually consistent about pulmonary embolism presentations is that they're so often confusing to us. And to compound that, they're also pretty infrequent. So we may not even consider it as a possibility when we're assessing the patient. So if you're confused by that low oxygen saturation, pale skin, general vague complaints, think about pulmonary embolism. Don't let it sneak up on you. In fact, have you had an unusual pulmonary embolism presentation? If you would go down to the comments right now, I would love to hear about your strangest pulmonary embolism symptom. Thank you for watching. I'm Steve Whitehead, and that is One for the Road.